You can heal. I need you to know this. This is a mantra that I tell my patients to kind of repeat. I talk about it in my virtual coaching programs. Your brain is not broken. Hey there, I'm Dr. Mark. I'm a concussion specialist. I've been working with concussions for the last 5 years, from pro athletes to youth athletes to grandmas to entrepreneurs and everyone in between. On this channel, we talk about concussion, post-concussion rehab, and how to get to work, school, sport, or just your regular life. Today, we're going to talk about what you need to know about post-concussion. So first thing right off the bat, post-concussion syndrome, persistent concussion symptoms, persistent post-concussion symptoms, PCS, PPCS. It's all the same thing. I like to call it PCS, post-concussion syndrome, or persistent concussion symptoms. I lean towards persistent concussion symptoms because it kind of describes exactly what it is. It's when concussion symptoms persist. They don't go away. So in this video, we're going to talk about, one, you can heal from PCS. We're going to talk about when it's considered PCS. We're going to talk about some general recovery timelines of concussion at large, so you can kind of see how that fits into the context of PCS. We're going to talk about the 5 symptom generators, and we're going to mention that each of those generators can lead to recovery. They can be rehabilitated. So the first note, you can heal. I need you to know this. This is a mantra that I tell my patients to kind of repeat. I talk about it in my virtual coaching programs. Your brain is not broken. So people, my brain is not broken. And how can we say that with any sort of confidence? It's from the data, from the literature. A concussion, let's define a concussion really quick. So a concussion can be interchangeably called mild traumatic brain injury. And when you define a mild traumatic brain injury, you'll see that a mild traumatic brain injury is a functional and transient form of TBI that results from acceleration and deceleration kind of transmitting to the skull. You get enough acceleration, deceleration, rotational, linear, blah, blah, blah forces that shake the brain to create a functional and transient, meaning a functional, not pathological, and transient or temporary form of traumatic brain injury. When we look at CT, when we look at MRI, we don't find anything. It's kind of par for the course. If we found something, it's not a concussion. It's more severe, or it's different, or it's an incidental finding, but it has nothing to do with the concussion. Concussion doesn't damage the brain. It functionally disrupts different networks and different regions of the brain that result in your symptoms. And so with that said, we can look to the 5 symptom generators, rehab those generators, and you can heal from PCS. If not to 100%, to a large enough degree that you can return to work, school, sport, life, right? So let's jump into general recovery timelines and then talk about when it becomes PCS. So what we know across the literature is that 70 to 80% of folks, so like most people, are going to recover in about 4 weeks after a concussion. That's actually a really good recovery time. So 3 to 4 weeks is right on par with when your brain energy metabolism returns to normal. I show that graph all the time. But we know that it takes around 21 to 30 days for your brain energy metabolism to go from kind of baseline pre-injury to recovery. And we know that around 70 to 80% of people are going to recover from concussion in that timeline. That's great. When we define recovery, we want a symptom score of less than 6. So post-concussion symptom scale, we want to see that less than 6. We want to see resolution of any abnormal exam findings. So we want your VOMs to be clear. We want your Buffalo concussion treadmill test to be clear. And in line with that exercise tolerance testing, we want your exercise tolerance to be solid up to like 85 or 90% of your heart rate max without symptoms. So we want exercise tolerance, we want normal physical exam, and we want low symptom scores. And what we'll see is that across all ages, around 45% of people say they recover in 2 weeks, meet that criteria. I would disagree with that. This is from a study called Less Than Half of Patients Recover Within 2 Weeks of an Injury After Sports-Related Mild Traumatic Brain Injury, a 2-year prospective study. So 45% of people recover in less than 2 weeks, 32.3% of people recover in 2 to 4 weeks. And so again, when you add that up, that's your 70 to 80% recovering in 4 weeks. That's what I would consider safe. About 17% of people are going to recover in 4 to 8 weeks, and about 5.7% of people are going to take longer than 8 weeks to recover. One thing to also note is that that previous study, the 2-year prospective study that we just looked at, that is assuming exercise tolerance, which means they tested for it. They tested for exercise tolerance, which means those people were probably rehabbed from an exercise standpoint at some point in the recovery, and that is not a strict rest protocol. When we look at a 2022 JAMA study that looked at concussions that were presented to the hospital system and then were kind of just discharged with informational pamphlets of like, you had a concussion, here's the injury, here's what to expect, rest until your symptoms go away, gradually resume normal activities, When they got those handouts, how did they recover? And what they looked at is, let's check out these people at 2 weeks and then at 6 months. And what they found is that at 2 weeks, 73% of people had an incomplete recovery. I'm fine with that. That makes sense to me. It should take 3 to 4 weeks for most people to fully recover. So, okay, at 2 weeks, 73% of people didn't recover. At 6 months, 56% of people still were not recovered. So when you don't do anything, around 56% of people are still going to have symptoms. So what do we consider normal PCS? When does concussion become post-concussion? When do concussion symptoms become persistent concussion symptoms? What we see from consensus data is that if your symptoms last for longer than 30 days, whether you're a child or an adult, that is now called post-concussion syndrome, persistent concussion symptoms. And what we see is that 70 to 80% of folks recover in about 4 weeks. We know that 20 to 30% of people won't. And if we don't do anything about it, maybe even as high as 56% of people won't. And a note here, kind of to echo the JAMA study, is that strict rest is being shown to worsen and prolong concussion symptoms. Rest until your symptoms go away is really garbage, outdated advice. I would run from any doctor who tells you to do that in 2024, 2025, whenever you're seeing this. So why do you have post-concussion syndrome? Why do you have persisting concussion symptoms? Why did your symptoms never go away? So we talk about symptom generators in concussion. It's very intuitive. What is generating your symptoms? It's a very creative name from the scientific community. There are 5 kind of generators that we see repeatedly in the research. It's going to be your autonomic physiologic symptom generator, and that's just a fancy way to say your blood flow is going to be wonky. Metabolic or hormonal issues, visual or vestibular issues, cervical spine, dysfunction, biomechanics, whatever, and then psychological trauma or overlap there. And so if we go step by step, autonomic physiologic problems are going to be related to blood flow, meaning after a concussion, some of the rotational aspects, some of the global stretching of the brain resulted in really wonky responses to blood flow, wonky responses to blood pressure, to gravity, to exertion, to cognitive exertion. And so at various times, you're going to get too little or too much blood flow. Some of it has to do with how you're breathing and your response to CO2. But one of the things that we know is that we can test your exercise tolerance. We can test your responses to gravity. We can look at your pupils. We can look at all kinds of things to see how your autonomic system is functioning and rehabilitate it. And a lot of times it's going to come down to sub-symptom aerobic exercise. It's really simple. It's not right for everyone, but for most people, like almost everyone, sub-symptom exercise is going to take care of that autonomic physiologic bucket. Moving on to the metabolic hormonal bucket. This one's a bit trickier. We just kind of work on this one in the background, but what we know is that after concussion, it's an inflammatory event. There's a neurometabolic cascade. It's a traumatic brain injury. It's functional, but there's an inflammatory injury that occurs. Some of that inflammation we know from kind of growing research on the gut-brain axis and sort of the gut's kind of everywhere right now in the research, but we know that within hours, we're talking like 3 to 4 hours after a concussion, inflammation from the brain can make its way to the gut, change the inflammatory sort of immune milieu of the gut that causes the gut to take up more stuff and kind of respond to inflammation. And that inflammation makes its way back to the brain, to the gut, to the brain, to the gut. And so we have this sort of feed-forward cycle of inflammatory gut issues. We know that some of the damage can actually impact the pituitary gland. And so it's crazy that we had to wait until the 2020s for this to occur, but some of the first like all-female concussion research is coming out. And we know that I believe it's about 18%. Don't quote me on that. I'll try to post the study up here, but around 18% of women will have a menstrual irregularity or abnormality within 90 days after their concussion. That's definitely a pituitary issue. When looking at the pituitary, a lot of this research comes from veterans and military data. And what we'll see is that a lot of times there could be problems with growth hormone, like growth hormone insufficiency resulting in cognitive symptoms. And there may even be an interplay with the gut-brain axis there. We see cortisol regulation issues. We see sex steroid issues, testosterone, estrogen, progesterone. We can see some thyroid issues. Bottom line is that some of the inflammatory event itself can also have some downstream effects impacting hormones, impacting the gut-brain axis. And so some of the ways that we would address that initially is just looking at your diet, looking at what you're eating. You eat, the food secure individual eats 3 to 4 pounds of food every day. And that's 3 to 4 pounds of metabolic fuel that can either tilt you towards recovery or away from recovery. So all of our patients will talk about how you want to eat. There's some supplementation that we can look at. Dr. Andy Galpin and Tommy Wood, I believe, and their team published one of the first papers that actually got some like sexy traction around nutritional supplementation. They just echoed a lot of the data that was kind of already published before, but there's nutritional supplementation strategies, creatine, fish oil, magnesium, different things that we can do to improve your recovery from the metabolic standpoint. But beyond that, it's going to be really patient specific. What do your labs look like? What do your symptoms look like? Do we need to do a hormone panel? Do we need to look at a stool test? Do we need to look at basic CBC, CMP, electrolytes, kidney function, iron, things like that? Moving on to the visual-vestibular bucket. This one is really sort of intuitive, but also not, as like, why would my eyes and my ears be impacted by my concussion? And it's because over half of the known real estate in your brain is devoted to vision and eye movements. And we look at traumatic brain injury research, I believe it's over 90% of people are going to have an overt oculomotor, basically meaning eye movement deficit. And so this is going to translate into dizziness, into headaches, into feeling, blurry vision or trouble reading or difficulty with screens. And the ways that we're going to look at that is through a vestibular oculomotor screening. Fancier clinics with cool tools might do video nystagmography where we throw the goggles on you. But we're going to look at just basic vestibular rehab, maybe some vision therapy. And then we also got to think about how your visual vestibular system ties into your neck. So the fourth symptom generator there of your cervical spine. All concussion has whiplash. You cannot reach the linear acceleration of concussion without passing by a long shot the linear acceleration for whiplash, for cervical strain and sprain. So cervical strain sprain happens around 4.5 Gs, maybe 5 Gs. Concussion occurs between 60 and 160 Gs, 70 and 120. The research kind of varies there. But regardless, concussion is about 15 to 32 times the force needed to sustain whiplash. If you had concussion, your neck was also damaged. If you move your head enough to shake and stretch your brain, you probably stretched some spindles and mechanoreceptors and different things up in your neck. So the way that we're going to rehab the neck is going to be through classic things like manual therapy, soft tissue, maybe some chiropractic adjustments or physical therapy or massage, whatever, even acupuncture. But the big thing that we want to do is make sure it ties into how your eyes and your ears are working, because you can't separate those systems. When I'm doing a VOR, we're testing my VOR here, but in order to test my VOR, guess what has to move? My neck. So when we're working on neck rehab, we also have to make sure the eyes and the ears are also playing along. And then the last bucket is going to be the psychological bucket. And this is one that I want to be sort of sensitive to and careful about how I explain, because this is not to say it's made up and it's in your head. Autonomic issues, metabolic issues, visual-vestibular issues, cervical spine issues can all cause anxiety and depression. Why do I have these symptoms? Will these symptoms ever go away? My heart is racing. Maybe I'm anxious. And so all of these things can cause anxiety, depression. Maybe the injury itself has some PTSD associated with it. And those psychological symptoms can flare any of these previous buckets, can flare the autonomic, the visual vestibular, the cervical spine. And so when we're looking at the psychological bucket, it can become a chicken and the egg. So I do have patients where psychological flare, meaning exposure to the previous trigger, exposure to a stressful situation, trying to deal with the litigious side of their injury, flares up anxiety, flares up irritability, flares up emotional lability, and then guess what? So does headache, and so does dizziness, and so does balance problems, and so does, you name it, difficulty remembering, brain fog. And then when the emotional stressor goes away, all these other symptoms go away. And so it's not to say, oh, it's in your head. It's to say, hey, there's a target for rehab. We can work on your orientation to the injury. We can work on through biofeedback, cognitive behavioral therapy, acceptance commitment therapy, dialectical behavioral therapy. There's all different approaches that we can do. Be a crucial adjunctive piece to the whole puzzle of your concussion rehab. We don't think it's silly to do subsymptom exercise and visual vestibular therapy. It's just as not silly to do subsymptom exercise, visual vestibular therapy, and cognitive behavioral therapy. It's a crucial piece of this. And so one of the things we'll see is that as we work on the psychological side, some of the physical symptoms go away. And as we work on the physical and cognitive symptoms, some of the emotional symptoms go away. And we slowly start to move towards complete recovery. So to wrap up, what you actually need to know about post-concussion. So what you actually need to know is that it's really common. 20 to 30%, maybe even more, of everyone who has a concussion is going to go on to have persistent concussion symptoms. And we see that that means that your symptoms last longer than 30 days. So a concussion happens, you get symptoms in the first moments to a couple days after the injury, and then they just don't go away, and it lasts longer than a month. That is PCS. We know that those symptoms are coming from autonomic issues, metabolic issues, visual vestibular issues, cervical spine issues, psychological issues. It is usually a mix of all of those or some of those. It is very rarely, if ever, just one of those symptom generators. And just know that each of those symptom generators can be rehabbed. So again, to echo the point at the beginning, you can heal from post-concussion. Thank you for watching. If you enjoyed this video or learned something, you might also enjoy or learn something from the other ones. I'm Dr. Mark. Thanks for watching.